Early on, pediatricians were reassured that COVID-19 disease was less significant in children, and we had hoped that it would not have as much of an impact on children as it turns out to have had. However, this was not only the medical complications of COVID-19, but the other unsuspected complications related to this pandemic. In particular, we began to hear from many families about being unable to come out for health care. They didn't feel safe taking public transportation. They couldn't afford private transportation, and with schools closed, they were unable to have childcare and figure out a strategy to bring an entire family for a pediatric healthcare visit. We began to hear many stories about food insecurity, behavioral health challenges, the lack of material resources. It really pushed our department to think about creative strategies to meet our family where they needed to be met. One of our most creative solutions was to develop a mobile health platform, a partnership with a local ambulance company, where we in fact have now brought a nurse, a physician, out to the families and to the homes of our families. Here, not only are we providing vaccinations, we're giving families food, gift cards, material resources, and advice around housing, medical, and behavioral health needs. Since we've started this mobile vaccine program, we've now reached almost 400 families out in the community. Our show rate for these vaccine delivery systems is almost 100%, and many of our families have been incredibly grateful, including the family who said to us, "I'm so appreciative that BMC is fighting for us." We may not necessarily be doing that fight entirely at the bedside, but we are doing it out in the community, in the homes, wherever our families need.